Hi friends! Today we're going to be reviewing a practice question similar to one you may see on your NCLEX Next Generation exam. Let's get started. This question is a standard multiple choice question, which most of the questions on the NCLEX will be this style of question. The nurse is caring for multiple clients with diabetes mellitus. Which of the following actions should the nurse prioritize when administering insulin? 1. Administer rapid-acting insulin promptly to a client experiencing hypoglycemia. 2. Administer scheduled long-acting insulin to a stable client. 3. Educate a client recently diagnosed with diabetes about proper insulin injection techniques. Or 4. Place an order for a client struggling to maintain normal sugars to receive diabetes education. Alright, this is a priority question, so remember, we're looking for the best answer choice. Take a second to pause the video, make your choice, then when you're ready, press play and we will review the question together. Okay, now that you've had a chance to review, let's go through each answer choice and try to narrow them down. First, administer rapid-acting insulin promptly to a client experiencing hypoglycemia. So first, let's think about rapid-acting insulin. Can you think of any types of rapid-acting insulin? Lispro and Aspart are two great examples. Okay, what about how rapid-acting insulin works? It typically works within 15 minutes of administration and is used to maintain blood sugar spikes after meals. So, if we look back at our answer choice, this is for a client experiencing hypoglycemia, and we would not want to administer that client a rapid-acting insulin, as we'd only bring their blood sugar even lower. So, we can cross off this answer choice. Moving on to the second answer choice, administer a scheduled long-acting insulin to a stable client. Okay, so let's discuss long-acting insulin. We know that it provides what type of a release? A steady release over an extended period of time, correct. Can you think of any examples of long-acting insulin? If you said glargine, you'd be correct. So, administering a scheduled long-acting insulin that we know is going to provide a steady release over the course of the day to a stable client could be a good option. Let's leave this one and keep reading. Educate a client recently diagnosed with diabetes about proper insulin injection techniques. As nurses, we know that education is important, but is it the most important task? If you said no, then you'd be correct. If the question mentioned the client preparing for discharge immediately, then it may take priority, but based on the answer choices we've read so far, this is not the highest priority. Alright, last option. Place an order for a client struggling to maintain normal blood sugars to receive diabetes education. So kind of along the same lines, education is needed, but is it urgent? No. There's also another piece of information in this answer choice that makes it incorrect. What do you think that is? Place an order. Yes. As a nurse, it would be out of your scope of practice to place an order. Although the order may be necessary for the client, the nurse would need to consult with the primary healthcare provider and they would place the order. All right, so this leaves us with the correct answer being answer number 2. Great job. Thanks so much for reviewing this question with me, and I'll see you next time.